want to make sure everyone was awake this morning before I get started. Let me make sure this is working. Here we go. So I'm Julie Whelan, and I appreciate you all coming to this morning. I had the privilege, right after I graduated from business school, of working for Harley Davidson. And I really do call it a privilege because I have to admit that I probably got more out of that experience than they got from me. It was a very humbling experience to work for a company as world-renowned as they are. I actually joined about the same time that they were trying to trademark the sound of the Harley. And if there's any Harley riders in the audience, I'm sure you're probably cursing me right now, because just hearing the sound of a Harley probably makes you long for being outside and on the open road as opposed to sitting inside a conference room. And that's why Harley tried to trademark it, is that they recognized that the sound of a Harley, everything about the Harley experience, it just evokes such emotion in people that it really is something that is ingrained in what that brand is all about. So that's what I want to talk about for a few minutes today. In working at Harley Davidson, what I came to realize is that it's not a rational purchase. No one buys a Harley for the quality. No one buys it to get from point A to point B, which I'll talk about in a second. It's a very irrational purchase, and it's really rooted in the emotion and what it allows people to do. And what that is that it allows people a way to express themselves to the world. It's a very loud expression of what you stand for and what's important, and that's freedom and independence. And you don't buy a Harley if you want to blend in. You buy a Harley if you want to make a statement. I really came to appreciate why someone would go as far as tattooing the name of Harley Davidson on their body. I love this ad. It's great. World's tattoo ranking, #1 is Mom, #2 is Harley Davidson. And here's a couple more images that just speak to that, if they'll come up. Come on. Here we go. When someone tattoos the name Harley Davidson on themselves, they're doing it because Harley, for them, it's such an integral part of who they are and what they stand for. They want the world to know that this is something that's really important to them. And there's a lot of ways, as I mentioned before, there's a lot of ways to get from point A to point B. You can take the bus, you can take an airplane, you can drive a Honda, there's a lot of different ways. You don't buy a Harley just to get from point A to point B. I love this ad. Somewhere on an airplane, a man is trying to rip open a small bag of peanuts. It's wonderful. That's such the essence of what Harley is all about. If Harley was just a mode of transportation, you wouldn't have ads like this. 5 billion stars don't fit in a 2-square-foot moonroof. People buy a Harley because they want to experience life. They want to experience the beauty of life and everything it has to offer. So what does all of this have to do with healthcare? I've been working in healthcare for a number of years now, and there's obviously a lot of chatter about patient-centric care. And I'm very intrigued by it, having worked for companies like Harley, and then I went on to work for some other really world-renowned brands as well. It was an intriguing question for me, and so I posed it. I'm part of about 30 different groups, healthcare groups on LinkedIn. So I went in there and I posed this exact question: how do you define patient-centric care? That's all I wrote. And from that, I got over 500 responses. And it was really intriguing to me, the number of responses and also the variety of responses, because I think the phrase has become so ubiquitous that no one really knows what it means. It's kind of like the word strategy or the word innovation. It means something different to so many different people. I also think, equally importantly, is that the term patient-centric care, by definition, even like the phrase itself, we're all going to look at it through a different lens. We're going to look at it as a patient and define, what does that mean for me as a patient? Or we're going to look at it as a practitioner or an insurance provider. We all come at healthcare from such different perspectives that, by definition, we're going to define patient-centric care slightly differently. So that was kind of an interesting aha for me when I saw these 500 responses come flooding back at me. I've spent enough time in healthcare. Here we go. I've spent enough time in healthcare. About 7 years ago, was diagnosed with stage 4 colon cancer. And luckily for me, after going through about 5 months of treatment, my doctors came to realize that it was actually only stage 3. I was in my late 30s at the time. I had a 5-year-old and a 1-year-old at home. And it's an understatement to say that that experience rocked my world. I think that I couldn't help, having gone to business school, having worked for all these really incredible brands, I couldn't help but go through that experience with a really different lens on of where is healthcare failing patients? Where was it failing me as a patient and not delivering to me what I needed in order to really heal? I then kind of launched out of that experience, thank God, and got my bearings again, and actually decided that I didn't want to go back to doing what I was doing previously, that I really wanted to get into healthcare and try and use the experience that I had to reshape healthcare. So I partnered with a number of doctors in my community, and I started the Center for Integrative Health and Wellness at Marin General Hospital. And with those doctors, we offered an outpatient program that provided things like nutrition counseling, exercise counseling. We actually brought exercise bikes into the infusion room. We offered a cardiac rehabilitation program, guided imagery, acupuncture, biofeedback, a whole variety of services, mostly outpatient, a lot of things inpatient, but that's a whole other can of worms in terms of the struggles and the barriers that I had to go through to offer programs inside the hospital. What I found is that there are so many barriers to delivering a really healing experience. There's misaligned incentives. It's a rapidly changing and complicated industry. It's fragmented, multi-layered. There's a lot of third-party payers that get involved that really distort the equation. There's the supply and demand that I learned about in college, being an econ major, that gets totally distorted when you add a third party in the middle of that equation. You add on medical device taxes, which are hitting a lot of companies these days. Come on, keep up. A lot of strong incumbent players who keep smaller startups from really being able to get in. It's highly regulated. And kind of the core of this presentation is that we have historically have had a very powerless consumer base that don't have an easy way to have their voice be heard in all of this. I had a really great mentor as I was building the integrative medicine program who said to me, a person can be healed and yet never be cured. And I witnessed that firsthand many times. I have a really good friend of mine who passed away from leukemia. She knew for about 4 years that she was fighting an uphill battle. And she passed away with such grace and such sense of having accomplished her life work. It was really remarkable to witness. And I saw that was very early on as I was starting the Center for Integrative Health and Wellness, and I saw that again and again with so many different patients who their disease did not define them. They didn't let it define them. It was a piece of who they were, but they had a life that they felt very satisfied with. I would add to this, though, that it's also possible to be cured and yet never be healed. And I've also witnessed that. As director of the Center for Integrative Health and Wellness, I counseled a lot of patients and a lot of friends who have reached out to me with relatives or whatnot who have gone through issues. And the example that I share here is a friend of mine who has a son who died of brain cancer at age 18. And he was being treated in the hospital. He was in his last days. They knew he was in his last days. And he was in so much pain that the only two things that would really help his pain was either acupuncture at the bedside, because he was completely immobile, or morphine. They knew it was his final days. He didn't want to be drugged up. He wanted to spend time with his family. His family wanted him to be coherent. And the acupuncture program was on a grant, and the acupuncturist didn't have regular hours and was off for the weekend that he passed away. And so he ended up, the only way he could control his pain was being on morphine. And so I really question, well, what's the point? If we're not healing the person, if we're just treating the symptoms and not healing the person and giving them what they need in order to really have a meaningful life, then what's the point? So how do we create patient-centric care? I think that it would be a lovely day if we ever get to the point that a medical center gets tattooed on the side of someone's arm. That I think we've accomplished our mission. But short of that, I have some other thoughts for how we get there. I think we need to understand what is needed in order to heal people emotionally as well as functionally. I think the acupuncture example, I'll go back to that in a second, or I'll go back to that now, the one that I referenced a couple seconds ago. When I was building my program, I wanted really so desperately to get acupuncture into the hospital. I had patients who were seeing an acupuncturist as part of my outpatient program. That was a very deep part of their healing experience. They would then get admitted into the hospital, and I was not allowed to have that acupuncturist go to the bedside and treat them at the bedside, even if the patient was willing to pay for it out of pocket. And I was just like, where's this breaking down? This is part of this person's healing experience. This is what's important to them. And yet I couldn't break through the barriers to make that happen. And the barriers that stop me is a whole nother conversation I don't have time for today. But I've actually decided that at some point, whenever I have a moment to catch my breath, I'm going to write a book called Swimming Through the Tsunami and chronicle my experience of trying to bring integrative medicine into our healthcare ecosystem, because it's a very, very challenging thing to do. The second thing that I think is very important is for us to focus as much money, energy, and time and resources on preventing disease as we do in treating it. I don't know if any of you have ever watched the movie Escape Fire. This is really what this movie is all about. And I reflect back often on, there's a doctor out of Cleveland Clinic who talks a lot about a diabetes patient that she's treating and how she literally does not have the time, she doesn't have the incentives or the time to spend really counseling that patient on what it's going to take for her to stop coming back again and again and again with her disease progressing. And it's all about prevention. It's the nutrition program that I was able to offer, the exercise program that I was able to offer. I think I would even go as far, and I'm sure this is very controversial for some people, but I would go as far as to say that I think it's borderline unethical for us as a healthcare system to treat people for a disease without also taking time to explain to them how they got that disease and how they can prevent it from coming back. I think that we need to give patients and providers a voice in shaping healthcare. And this conference has been amazing for me to attend because I've heard this theme again and again and again. I've had the chance to talk with a lot of the startups that are upstairs and hear some of their stories and how they got started. And it's wonderful for me to hear that it's patients, it's physicians, it's nurses. Interestingly, I was trying to think of an example that I could share here of how Harley did this. And one of the best examples, when I first started at Harley, I worked in the licensing department, and I was in charge of all the apparel and accessory licensees to make sure that they were doing what they were supposed to be doing in terms of licensing our brand. And one of the top t-shirt licensees that we had actually started as a counterfeiter. Our executives met him at a rally. He was selling t-shirts out the back of his van, like crazy. And in some cases, companies would have gone after someone like that and said, you need to stop. You need to reimburse us for all the money that you should have been paying us. Instead, what they said was, you know what? You're onto something. You obviously understand our customers. Why don't you come and be part of our family? And it became one of our most successful t-shirt licensees. I'm sure they're still around. They did a phenomenal business. So it's kind of embracing that t-shirt company. They knew they were the customer. They knew what customers wanted, and they were delivering a product that people really responded to. So instead of trying to shut them down through some legal barriers, which Harley could have done, they instead said, you know what, come be part of the solution. Come help us reach our customers in a more meaningful way. Where I am today, I left the Center for Integrative Health and Wellness. I passed the baton, as I say, to go and do something very different. I now work for a company called Edison Nation Medical. And what we do is that we enable the everyday inventor, or the physician, the nurse, the patient, the caregiver, the entrepreneur, anyone who has a great idea for bringing healthcare, to improve healthcare and improve the quality of life for patients. We can help those people break down the barriers and bring that idea to life. We only make money when we are successful in helping the inventor to make money. We work with a lot of small companies that are hitting one barrier after another. We partner with a lot of, we're actually born out of a collaboration with Carolina's healthcare system, and we have a number of other really big partnerships that we're going to be announcing between now and the end of the year. In my mind, the fact that we can take a doctor's back of the envelope sketch and actually literally turn that into a product that we can put in front of Covidien or put in front of Medivators or put in front of Massimo or Hill-Rom and say, what do you think of this? This is an idea from a doctor that we work with. Or that we can take a startup that's struggling to get traction, struggling to get clinical trials in place, and we can connect them with the right healthcare system and have those clinical trials happen and start to get them the scale that they need to really reach patients around the world. It's so motivating to me, and that's where, in my mind, we start to enable the patient, the caregiver, the different providers to really have a voice in shaping healthcare. So I think that was my signal that I need to wrap it up. Here's my perspective. Somebody asked me on LinkedIn, what is my perspective of patient-centric care? This is my perspective. It's not the destination. It's not the destination. It's not about getting them treatment. It's about the journey that we take people on and making sure that we meet them where they want to be met. It's not easy. All of this is going to require compromise and sacrifice. Breathing is automatic. Living takes effort. It's really worth it in the end. So I would love to continue the conversation. I'm obviously passionate about this. If any of you want to connect with me, there's my contact information, and I look forward to hearing from you. Thank you.